Caviar time, caviar time. Not caviar time, that's different, right?
That's different. No caviar right now.
Hi, I'm Dr. Gary Motykie, and I'm a board-certified Beverly Hills plastic surgeon. And today I was going to go through the difference between a full facelift and a mini facelift. There's a lot of patients come in asking, do I need a full facelift, a mini facelift? What's the difference? And it is a very confusing landscape, to say the least. A lot of it has to do with marketing out there and different techniques that are marketed as minimally invasive or mini lifts, and they're really facelifts. And there's a lot of that going on out there in the world of plastic surgery. So I think I wanted to start out by saying, what is a traditional facelift? What does it do? And a traditional facelift is mostly a neck lift, so we're dealing a lot with tightening up a lot of the lower face and the neck, right, and in the jowl area and loose skin in the neck. But the facelift is addressing this area of the face, from about the cheek to the neck. And the first part of it is to tighten up the neck. The second part is to tighten up the lower part of the face, the jowl, and the third part is to then take out all the loose skin. And that is the traditional facelift. Now, the mid facelift that used to be out there was where they came in the hairline and just lifted the cheek or this mid face part. A lot of doctors have steered away from the mid facelift because it can also change the eye shape, move things around, and have gone more to fat grafting or adding volume back into the cheek rather than trying to pull and change the shape of the eye. And then there's the brow lift and lateral brow lift. Similar to mid facelift, it does address the corners of the eye and the entire brow to lift and reshape the brow if it's come down and gotten heavy with the aging process. So in general, that's the three parts of the face: the lower face, the mid face, and then the brow. And sometimes all three are done together, and sometimes just one part of the face, or the neck and the lower face, which is, again, one of the most common early signs of aging. Patients coming in saying, I don't like my profile, I'm seeing sagginess or the turkey gobbler or things in the face. And those, again, are addressed with a traditional facelift. So where did the term mini facelift come from? The mini facelift is really just a simple little tuck right here, and it really only is going to address a little bit of tightening in the jawline. Now, the interesting thing about the mini facelifts is they come with some of the similar scars, but not as dramatic or as long-lasting results as the full facelift. And the reason is it's only really addressing one layer of the face. It's only pulling on the skin here and tucking in the skin a little bit here. And the incision is, again, hidden by the ear. And in that mini lift, remember, the skin is elastic. It stretches. If we gain weight, pregnancy, things like that, we see the skin can stretch because it's made to be elastic. So if we try and put all the repair on the skin only, what happens over time is the skin slowly stretches. So a lot of patients that get mini lifts come in and get the surgery done, and they notice that after a few months or a year that it looks exactly the same, that because the skin stretched out and things settled and there wasn't a lot of sturdiness to the repair and the lift, so just slowly over time it went back to where it was before the surgery. They have scars, they're left disappointed. So it's one of those procedures that doesn't have as high a satisfaction rate as the traditional facelift. So the other thing to mention about a mini facelift is there's no incision under the chin to directly address the neck, and that's one of the major concerns about patients coming in for facelifts. It's usually the jowls or the neck. And since no incision is being made here, there's no tightening of the neck muscles and doing all the work in the neck, and it's just pulling here. So if there's a lot of looseness here, it's not going to do very much for the neck at all. So again, it's patient selection for that mini lift. Most patients aren't going to come in looking just for this little tuck here. And then again, I think the biggest thing is that longevity of the procedure. A lot of patients get disappointed because the results didn't last. And that doesn't mean that it's also cheap. A lot of the times patients coming in for the mini lifts will pay a lot of money for the mini lift and then being left disappointed because they didn't get the results they wanted or the results didn't last very long at all. So what's the difference between a mini lift and a full facelift? And we've kind of already hinted to those things, right? So I think one of the big differences is with a full facelift, you're not doing only skin tightening. You're dealing with multiple lifts and multiple layers of the face. And that's important for several different reasons. The first reason is getting the vectors right and making it appear natural, because certain part of the face you want to lift in different directions. When you have jowls, you want to be lifting underneath the skin and pulling them up tightly with what's called the deep layer of the face. That's where the strength of that full facelift lies. Secondly, then you want to be pulling gently the skin back and not pulling and distorting the face with just the skin. You're just gently pulling the skin because the deep layer repair is really going to hold up over time. Next is also the neck, so you're going to be making a small incision here as well as the incision by the ear to go in and directly address the muscles that come down with aging or the banding that you see in some people called platysma banding, and you bring those neck muscles up like a hammock and you sew them together, really give a nice strength to the repair in the neck and as well as the profile so that the jawline looks beautiful and elegant. And then lastly, adding in a little bit of fat grafting along with that lift to give a little volume to the face in certain areas. So all of these things are done with the full facelift, whereas the mini lift is just that small incision and a little tuck of skin over there. Just remember that deep layer is that sturdy part of the repair. It's not as elastic as the skin. It holds up. So when patients go for the full lift, they're much more satisfied long term because in the beginning they may be a little bit more swollen, but in the end, the results are much more natural, long-lasting. Everything about that procedure for them, the end, is going to be a better long-term result. And then secondly, patients are like, well, if it's a bigger facelift and full, it's going to be more painful. There's going to be a longer recovery. No, it's not more painful. Actually, the face is kind of numb. It's not a big painful surgery. There may be slightly more recovery because you are doing slightly more work. But in general, again, I think the trade-off there is that the results are so much more superior. One caveat I want to make about facelifts, because I hear a lot about it, is the term ponytail lift. So, what's the difference between a mini lift, facelift, and a ponytail lift? And a ponytail lift is really kind of a marketing term that's used by some surgeons. And it initially came about, they're telling patients it's a way to mimic what the look is if you were to put in a really tight ponytail and scrunch it up, what would it do to the face and pull up on the face. And in generally speaking terms, it's kind of a misnomer because it's really not necessarily a facelift. A ponytail lift usually typically involves an incision, small incision here in the hairline, and it's more of an endoscopic lateral brow lift, mid-facelift with a little addressing into the jowl area. Because the small incision's here, the thing about it is that there's not as many candidates as you think for that type of a surgery because, again, it's not going to address the neck. It's not going to address removing any loose skin. So it's more for a younger clientele that only want a little bit of a minimal lift or minimal correction because, again, if there's a lot of loose skin in the neck, a lot of jowling, a lot of things going on in the face, it's not going to address all those issues. It's going to do more, again, of that lateral brow lift, mid-face lift, and not necessarily give you the results you're going to get with that traditional facelift if you have a lot of loose skin in the neck and a little bit older rather than a younger patient that just needs that little nip and tuck. So what I don't want patients to do is go in and do a ponytail lift thinking it's going to give them results of a traditional facelift because then they're just going to end up being disappointed in the end. One last thing that I want to mention, because it has some similarities to the ponytail lift, is thread lifts. And again, it's patients that are going to come in and saying, why can't I just do a bunch of threads and get the same result as a facelift? And again, it's because the threads are placed in the skin, right? So you're able to get some lifting with the threads and some repositioning of the tissues. But again, it's not going to lift up a really heavy neck or correct really heavy jowls if what you really need is a facelift. And the threads themselves, again, are not permanent. They're not going to last forever. They're not going to hold up long over time. So I don't want patients coming in doing a lot of threads thinking they're going to get the same result as a traditional facelift because they're going to end up, again, being disappointed. So lastly, don't get confused by gimmicks and marketing that's out there because any of the traditional, contemporary, time-tested full facelift procedures, they've already stood the test of time. They're going to give you a very high satisfaction rate. Most of those patients are very satisfied with the results. They end up looking very natural. The results last a long time, and so therefore they're very satisfied with the surgery. The biggest factor is to go to a well-trained, well-experienced surgeon than going for one of the newest, flashiest techniques that hasn't yet stood up against the test of time.